Hello and welcome to Health Connections. I'm your moderator, Barbara Brown, and my guest on today's program is Greg Lee, AIDS Coordinator for the Lexington-Fayette County Health Department. On today's program, we'll be discussing AIDS, what we know. It's good having you on the program today,
Barbara.
Greg. Let's start with a little background history on this deadly virus. Tell me a little bit about what we know in terms of AIDS, how it first became noticeable, and when the first person seemed to have been diagnosed as having AIDS.
Okay. To begin with, we're not exactly sure how long AIDS has been around in the human population. We do believe that, based on epidemiologic evidence, that AIDS has been around in Central Africa or certain pockets of Central Africa for a great while, perhaps 20 or 30 years or more. The first notice of AIDS, though, in the medical community was in June of 1981 when an LA physician noted young gay men with pneumocystis pneumonia, 5 of them, in this particular doctor's practice all at once. So that's basically when the medical community first became of the situation.
Mm-hmm. Well, the acronym AIDS has become part of our modern day usage.
Mm-hmm.
We all know basically what that means. Does the scientific community also refer to this virus as AIDS, or do they have different names for AIDS?
There have been a couple of names tossed around. AIDS is a part of what can happen to a person when they're infected with what we can call the AIDS virus. The AIDS virus is currently called HIV, stands for Human Immunodeficiency Virus. And actually, Barbara, doctors that work with AIDS more than others are getting to the point where they're referring to HIV-related disorders or HIV disorders instead of just AIDS. Because to refer to just AIDS is actually to refer to just part of the overall problem. A person can be infected with the AIDS virus and they might not ever be diagnosed with what you and I are calling AIDS, but they might have medical conditions that would require physician's care.
Mm-hmm. Well, how soon after infection would a person begin to show virus-like symptoms?
One of the first things that happens when a person is infected with HIV, the AIDS virus, is an acute viral syndrome, much like mononucleosis. Often it's very mild and goes unnoticed by the person who's been infected. And generally speaking, that is a short stage. In other words, that's an acute viral syndrome that does come to an end. And more often than not, they go into an asymptomatic stage where they have no symptoms at all. They would test positive, however, for the antibody test.
Mm-hmm.
So that would be the first viral-like syndrome that a person would expect if they're infected.
Mm-hmm. Well, if AIDS is like a virus or is a virus, does it attack the white blood cells within a person's body?
Yes, it does. The AIDS virus attacks a particular white blood cell, which is an important, very important part of the immune system, known as the T4 lymphocytes. And the destruction of those cells is what leads to the condition of this immune disorder.
Mm-hmm. Well, in AIDS literature, I've come across something called ARC. What exactly is that, and what does it mean to the person that might have it?
ARC, or ARC, stands for AIDS-related complex, and Barbara is generally a layman's term. In other words, there's no medical definition or no medical way of actually diagnosing ARC. Generally, it's referred to a person who has not been diagnosed with AIDS, but is infected with the AIDS virus and has 2 or more of the clinical symptoms of HIV infection, such as a chronic diarrhea or night sweats, for example.
Mm-hmm.
So it's sort of a catch-all term.
Is it possible for a person to be what we would term a carrier of the virus and actually be walking around and perhaps have tested positive but never become sick with the AIDS virus themselves?
We don't know. First of all, anyone who is infected with the AIDS virus is considered a carrier, whether they're well or whether they're sick, because they're all carrying the virus. This is a type of virus that we believe once a person's infected, they will remain infected. In some respect, like with herpes. Once a person has herpes, they'll always have herpes.
Mm-hmm.
Whether or not some people who are infected with the AIDS virus will remain to be just carriers for the rest of their lives and not get sick is a question that none of us can really answer right now.
Mm-hmm.
Although AIDS has been around for years, remember, we've only known about it for 7 years. So what we can say is what will happen to at least a percentage of the people in a short while, such as 5 or 6 or 7 years. But what we can't answer is whether or not these people who are still well but infected, whether or not they'll remain to be well for the rest of their lives.
Mm-hmm.
We don't know.
Well, we understand at this point that AIDS is a problem in the homosexual community as well as for people who are IV drug users. How real, though, is the threat to the heterosexual community? A lot has been written and talked about in that respect, and I'm sure that we're all very curious about that. Is it really something that we all need to be concerned about?
When you say heterosexual community, and we all say that, I think that's an effort to isolate ourselves or heterosexuals isolating themselves and looking at it as their problem. I think some facts to point out before I even start to answer the question is let's look at Central Africa and remember that AIDS has been there and has been epidemic there for some time and is almost purely a heterosexually transmitted disease there. When we say heterosexual community, referring to that community here in the United States, we can't separate them as a static entity. In other words, although there are more homosexual men with AIDS than there are heterosexual men with AIDS, proportionally, what about the bisexual men who are, I guess you could say, half homosexual, half heterosexual? Mm-hmm. And certainly the majority of IV drug users are heterosexual. The things that we've noted from research is that the AIDS virus is not easily transmitted from women to men through sexual contact so long as there's no genital ulcerations from other sexually transmitted diseases. Because of that, heterosexual transmission through sexual contact, at least here in the United States where STDs are generally treated, doesn't seem to be as big of a problem as it is in Central Africa. But to be most honest, only time will tell.
Mm-hmm. Well, from research and based on experience in this country, what have we determined are the actual methods of transmission for AIDS?
There are 4 basic methods of transmission. The first and most prevalent is sexual contact, where there's an exchange of the virus through semen, blood, and or cervical secretions. The second most common method of transmission is through intravenous drug use, where people are sharing needles and the virus is being transmitted through blood remnants that are inside the barrel or inside the needle or on the needle. The third, what is probably one of the highest accelerating problems, is parenteral transmission from an infected mother to her fetus. I said parenteral, I meant perinatal. Mm-hmm. The fourth way of infection is through blood transfusion, and that's a problem that is working itself out.
Mm-hmm. Well, what does the future hold for the children who are born and their mothers do have AIDS? At this point, are those children in most cases becoming sick with the virus themselves within a short period of time?
When a woman is infected and she gives birth to her first child after infection, she stands anywhere from a 40 to a 60% chance of passing the virus on to the child. So that's roughly a 50-50 odd. The unfortunate part is that if a baby isn't born with the virus, most often they don't survive beyond 2 years. Their immune systems aren't fully developed when they're born, and therefore they're starting behind the starting line as adults would with that viral infection.
What is the likelihood of a woman in her 20s, for example, who has had a brief sexual encounter with a bisexual male? What would her chances be of actually developing the AIDS virus herself within the 5-year period?
First of all, we can't assume that every bisexual male is infected because the majority of them are not. For example, Kinsey estimates that there are, 10 million gay and bisexual men, or 14 million gay and bisexual men in the United States. Centers for Disease Control has estimated that as many as 1.4 million people are infected, and of course, not all of those are gay and bisexual men. So the majority of gay and bisexual men are not infected. If this bisexual man were infected, a one-time sexual contact, if we're speaking about vaginal intercourse as opposed to anal intercourse, is probable, well, I can't say probable, but it's very possible that she will not be infected. The virus has got to find an entry into the bloodstream, and if there are no fissures or no tears or no rashes or whatever, the likelihood of her infection would be reduced. I think it's a risky situation, though, certainly, and a condom should be used by all means.
Well, we've talked for a few moments about the methods of transmission. I wonder if you could briefly touch on the ways that AIDS cannot be transmitted.
AIDS is not transmitted through casual, non-sexual contact. It is, however, transmitted through casual sexual contact. The studies that are very significant for this question are studies involving families of people with AIDS, people who live with people with AIDS and take care of them and share food with them, and in certain situations have even shared toothbrushes and razors. Why anybody would want to share a toothbrush, I don't know. But generally, well, not generally, absolutely in every one of these studies, they've all revealed the same thing. Nobody gets infected unless they are a sexual partner with the person with AIDS, or are a child born to a person with AIDS. So ways in which the AIDS virus is not transmitted are things like sharing bathroom facilities, sharing towels, sharing dishes, sharing telephones, sharing swimming pools, sharing hot tubs, sharing brushes and combs, hugging a person. For a person to get infected with the AIDS virus from someone who has the AIDS virus, that person who has the AIDS virus would have to get their blood, semen, or vaginal secretions inside the other person's body. So anything that you can think of, Barbara, in which that does not happen, well, that's a way that you don't get AIDS.
I wonder if you could touch on how you feel the teenage population is absorbing the information on AIDS. I know that you spend a good part of your time talking to groups in our community trying to get them to learn more about AIDS. Do you find the teenagers are more receptive at this stage, or are they still feeling it's a disease that they don't need to concern themselves with?
I'd like to say yes, they are more receptive, because when I talk to teens, that's a good indication that, you know, I've at least been invited there to talk to these teens. But generally, the increased rate of sexually transmitted disease and teenage pregnancy is real distressing. Those are the same risk behaviors that you would find people infected with the AIDS virus having. So the problems of being a teenager are complex. You know, we're talking about people who, the death is one of the farthest things from their mind. And they're still, like many adults are saying, it can't happen to me. One statistic that is also distressing is that a good percentage of people with AIDS are in their 20s. AIDS, as we know, has an incubation period of 5 years or more. So that means we're talking about a lot of people with AIDS already who might very well have been infected while they were teens. So it's a very big issue. And at the current rate, the way things are going with sexually transmitted diseases and teen pregnancies, I think nothing good is going to come out of that. Something does need to be done to try to help teens hold off on sexual experimentation as well as drug experimentation.
Well, you mentioned the incubation period being 5 years or more. Realistically, how long should a person be concerned if they feel that they have had a potential encounter with a person that may have been infected? Should they go on for a period of 10 years thinking in the back of their mind, you know, they could be infected with the virus?
We get a number of calls at the health department from people who would like to exclude themselves from that kind of worry because they've had sex with somebody that they didn't know very well, or some sort of contact that would put them at risk. And they're wanting to have somebody assess them medically and say, you're okay, you're guaranteed to not have to worry about AIDS anymore. And we just can't do that. We cannot guarantee that people don't have to worry about AIDS if they have high-risk behavior. I think the most important thing is to have people look at their high-risk behavior and get them to alter that behavior and to alter their attitudes about their sexual behaviors. If a person does feel that they've really had a truly high-risk exposure of potential of infection, they can certainly call and inquire about antibody testing. Which would give them a clearer idea, perhaps, as to whether or not they've been infected. The problem, though, is they usually call the next morning because they're feeling guilty or whatever, and it doesn't work that way. The test is an antibody test, and it's going to take your body a good couple of months in most situations before antibodies are even begun to be developed at detectable levels.
Well, what resources are available at the health department to help a person either learn more information about AIDS, or perhaps if they are feeling that they would like to be tested for the virus?
If a person's wanting to learn about AIDS, one of the simplest things that they can do is just call. You know, we're not going to ask them who they are or anything like that. They can call and receive information from the AIDS program, or from the sexually transmitted disease program, or from family planning, or many of the clinicians are well equipped and able to inform people about risk reduction for AIDS. If they're specifically interested in antibody testing, they would need to call the AIDS program. The health department here in Lexington, Barbara, does provide free of charge and on an anonymous basis the antibody test. And that is always done in conjunction with pre-test and post-test counseling.
I see. Well, the Surgeon General has been promoting a campaign for condom use for about a year now that I've noticed it very prevalently. Do you feel that that has benefited the average public? Do you think that people are more aware and are finding that condoms are an alternative to their other habits of going without any protection?
Yeah. Dr. Coop is not just promoting condoms, he's promoting a 3-point risk reduction. The first being abstinence as being the most effective means of reducing the risk. Of course, IV drug use aside. If you don't have sexual contact with anyone, you're not going to have the risk of sexual exposure. The second level of protection that Dr. Coop speaks of is monogamous relationships, long-lasting sex partners who just have one other sex partner, one-on-one relationships. If the first two fail, that's when he gets into promoting the use of condoms. And to answer the question, are we seeing condom use increased? In gay men, yes. In the heterosexual population, not necessarily. The reason I think we can say that is because of the sexually transmitted disease rates across the country, and here in Lexington, sexually transmitted disease rates among homosexual and bisexual men has greatly decreased, which means one of two things. Either they've stopped having sex, or they are practicing safer sex with condoms to avoid the transmission of sexually transmitted diseases. We can't say that for the heterosexual population at this time. I think there's still a lot of the phenomenon of people saying that that's their problem, whoever they is, and saying that it's not going to happen to me. I'm not going to use condoms because I don't think I have anything to worry about.
Well, recently in the news we have seen reports of parents of school-age children seemingly to be very fearful of letting their children attend a school where there are other children that are perhaps hemophiliac and do have a problem with AIDS. Is there any real threat to those children, or what can we do to really reevaluate our thinking so that the parents do not have this hysterical notion about AIDS?
Yeah. We know of no one at any time, at any place, being infected through casual contact, such as kids in a playground or whatever. And there are a lot of theoretical risks, Barbara, but in all reality, those risks generally aren't taking place. Again, this gets back to the study with families of people with AIDS. Well, these people who live with people with AIDS often do include children. So to get parents to look at that on a logical level instead of a purely emotional level is a very difficult thing. I think one thing that helps in those situations is if the school, local school board has an AIDS policy prior to the situation becoming an issue, which is what the local school board has done. They've already gotten their policies in line so that if and when a situation such as that arises, they know what to do. They're not caught off guard and scrambling for policy at the last second. I think that's a major step in calming the public and dealing with this in a responsible manner.
Well, part of that goes back to how people think that AIDS can be caught in a very real sense. Is it possible through other body fluids rather than through a sexual encounter to have some danger and exposure to AIDS?
I'd like to say that it's not possible, but I can't because that's one of those theoretical what-if situations that we may have to deal with for centuries to come. But I can say that we don't know of any other transmission from body fluids other than blood, semen, and vaginal secretion. Well, possibly vaginal secretions. We're not even sure about that. The AIDS virus has been found in traces anyway, in many body fluids with people who have the virus. The unfortunate part of that is that people assume that that means that the virus can be transmitted through those fluids, and we don't know that to be true.
Well, let's talk for a moment about blood donations. People were sort of worried a couple of years ago about if they needed to have a blood transfusion, is it possible that that blood would be tainted with the virus? What have we done in our communities to make sure that that would not be the case?
Since mid-1985, when the FDA licensed the screening test for AIDS virus antibodies, the blood supply has been much more protected than ever before. As I said earlier, that fourth means of transmission through blood transfusion is a problem that is generally working itself out of the system. We will still, however, continue to see people develop AIDS who were infected through blood transfusions prior to the screening of the blood supply in mid-1985. In 10 years or so, that's not really going to be an issue.
Well, the federal government recently passed guidelines to protect employees of the government that have AIDS and to really work with their coworkers in an educational sense. How do you feel that that will benefit our community in a very general sense in making everybody more aware that AIDS is not potentially the threat that they think it is from casual contact?
Both in government and in the private sector, policies such as that need to be aligned before they're caught off guard. I think the federal government's issuing such a policy is very important because many people look to the government as an example of what to do in a situation. So their policy of providing education to their employees and against their policy against discrimination is very timely in that there are a lot of people looking at developing policies now on dealing with AIDS. AIDS is something that's not going to go away. So we're going to have to learn how to deal with it. And we do need some leadership from the federal government for that.
Well, Greg, in wrapping up today's program, this is not an easy answered question, but what hope do we have of a cure for AIDS in the near future?
Curing AIDS is a very complex issue, obviously. Dealing with the virus and trying to destroy the virus inside a human's body is a very tough thing to do, and even if we could do that, we still have a person whose immune system has been stripped. So I think instead of talking about cure, because I can't even begin to really answer that very accurately, it seems to be very, very far down the road, if it's there at all.
Well, Greg, thank you so much for being a guest on today's program. It certainly was very informative. Join us next week for another segment of Health Connections.